Good morning, everyone.
Good morning.
So, Jerry, today we're going to talk about something very serious. So, I think there'll be very few laughs today.
Yeah.
We're talking about killing.
Oh. Well,
No,
not
we're
really.
talking about adjustment disorder.
Why people kill.
No. I think there was a recent case of a man who murdered his wife and his unborn child. I didn't catch this one in the news, actually.
That's what I mean.
Yeah, but it's different. We're not talking about it. We're talking about the disorder that perhaps stemmed from that. So what was are there any more details to the story that I might have missed, Dr. Jerry?
Well, they diagnosed him with adjustment disorder. That's why we're talking about adjustment disorder. Yeah, so apparently he was told the wrong numbers, financial numbers in his business. And yeah, he felt that he could not deal with it. It was like the end of the road. He didn't want to burden his wife and his unborn child with that. And he couldn't find a way out, basically. So he then stabbed his wife, and he tried to kill himself, not very successfully. Yeah.
So he had less money than he thought he had. Eventually,
he thought he was in the red, but actually his business was in the black.
Oh,
So it was
wow.
yeah.
But many people are in the red. What? They don't go around killing people.
Hence the
that's why
adjustment
we are
disorder.
talking about it. And we've talked about depression, we've talked about anxiety. I guess why the excitement of this piece was because the diagnosis was adjustment disorder. And like you say, there's a killing, right? There's like murder involved. So I think a lot of people started to get very afraid and started to ask whether, does adjustment disorder lead to like self-harm or aggressive behaviors? So that's what we're going to talk about today.
So what exactly is adjustment disorder?
But more importantly, I want to find out whether this person is in jail now.
I think the case is
Because you say he
probably
didn't-
ongoing,
The
right?
case is probably ongoing. Yeah.
It's quite recent.
Really?
No?
Yeah.
It is,
Let
okay.
me try and see.
Okay.
He's already convicted, yeah.
Oh, okay.
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 So he is in jail then.
Yeah.
Okay. Let's continue this conversation on The Big Show TV. Up next, Miley Cyrus used to be young on Kiss 92.
Yeah,
Okay.
so what is adjustment disorder, Dr. Jerry?
Yep. So when something that is very stressful or a change happens, so we do have adjustment disorders diagnosed, and we hear that with children going to primary one, going to secondary school, those that go into the university. So as long as there is a change, and the change is stressful enough, that's why we keep talking to people, or we talk on the show about parenting, how to prepare your children for P1, how to prepare them for university. We talk about your first job, getting married. So all these are changes and transitions. We know that life changes and movements can be stressful. So that one is, public knowledge. Everyone knows that as long as there is a change, it is stressful. You move your house, you change a new car, there's a death in a family, there's a death of a pet. All these are stressful. And it can be happy things, graduating, going into, marriage life can all be very exciting, including having a new job. Your dream job can be exciting, but it is also a change. And that any sort of adjustment, we're talking about adjustment. But when there is a disorder, it needs to cause a severe enough dysfunction in that environment for a sustained period of time. So we're not talking about just settling in. We're not talking about, okay, the usual, first 2 days I feel stressed, or first week I feel stressed. The behavior or the reaction, our reaction to the stressful event is actually quite disparate. That means it is not appropriate for the situation.
So what is counted as dysfunctional then?
Yeah.
Because as you said, life is an entire adjustment because it's constant change, right?
When you kill someone.
No. Okay, not as bad as that, but I'm
Yeah.
sure there's something less than going around murdering people around you.
Yes. Yeah, so you cannot do your work, you're there. Perhaps you feel like, I don't want to go to work. You take a really long time. You are missing school. You're missing work. You are unable to bring yourself to do your tasks. The withdrawal from people. So some of these signs and symptoms can mimic depression and anxiety. In the younger children, there's acting out behavior, there's tantruming, there is separation anxiety. So you have your your lashing out, your irritability.
You like
So
me
you can-
yesterday. I was like that yesterday.
Yeah, a bit.
I was
did you do?
irritable. I was moody. I was just in a bad mood yesterday.
But yours was not a disorder
It
because
wasn't,
not
yeah.
for a prolonged period of
Yeah.
time. It was
But I
just
think
like-
I know why.
Why?
I haven't been drinking enough.
Oh,
You said you've
I-
given up. Don't
Clearly.
don't go
Not
back.
I know,
given
I
up.
know.
He hasn't
But now I
given-
feel
he-
like it.
No, don't go
he
back.
hasn't given up.
I've
No, but
cut
he's cut
down.
it down.
I've been
Cut
trying to
down,
cut down,
And
But
you
maybe
have.
I'm going through a little bit of a
Withdrawal,
withdrawal.
you could be.
Yeah,
You just need to get over it.
Don't go back down that road, okay? Please.
What?
Well, he's
Like, you know what I feel like having right now? A beer.
No, you don't need it. You don't need it.
But he
You've
wasn't an alcoholic.
You've
No, I
got,
wasn't.
you've got a crew here that are your friends and got your back. You
I'll
don't-
get
you
all
don't
of your
need-
one beer
No,
each.
no.
I don't mind
Jerry,
beer, actually.
Getting back
Yes,
to Jerry. Jerry, I understand this problem when we're dealing with primary 1 kids, primary 6, secondary 1. They may not be mature enough to handle the stress and the changes. But why is it that some people can have this change in their life and it doesn't affect them, but with others
you can't.
they just can't cope? Well, what is it? Why?
We always get asked this question, right? So, and the question is, are these people weak? No, these people are not weak. It could be various factors, right? When we call it, the perfect storm, isn't it? When everything comes together, when the stars align, it can either go all right or all wrong. So it could be a lot of different variables coming together that breaks a person, and the person cannot manage. In fact, adjustment disorder, a lot of people would ask, is there a way to prevent it? It's quite tough to prevent it. I mean, like you say, life is a series of adjustments, right? But we don't know what might the person require at that point in time, or what might the person be going through at that point in time, such that they are unable to manage it. We do know the usual. So the 5 pillars that I always tell you about, right? The physical, keeping yourself healthy. The intellectual, to continue to stimulate the brain and learn. You have your social, which I truly emphasize each and every time. And just now, FD and Angel demonstrated for Glenn that the social environment is so essential for any change to happen.
She just said go
Yes.
drink. Yeah, you should go drink porn. That's what she's saying.
Right? I should
Yeah, she's saying. Yeah, you need to be social. That's what she
Yeah.
said. You're being antisocial right
Plus, I haven't played golf in 2 months
There you
already,
go.
which means I haven't had my usual sessions, my drinking sessions with my friends and all that.
So now you've got 2 things.
Yeah,
What?
I think so.
Oh.
That's why.
2 changes.
Okay, wait, we're going back on air.
Yes.
Don't tell
Okay.
anyone about me on air, please.
now.
I said, ooh, I'm blinded by the lights. No, I can't sleep until I feel your touch.
Kiss 92 traffic.
On the SLE towards the CTE, just before the Upper Thompson Road exit, an accident has been reported. This is causing quite a bit of congestion all the way back to Mandai Avenue's exit. Avoid lane 2 or avoid that stretch altogether. Also on the AYE towards Tuas after Penjuru Road's exit, a vehicle has broken down. Stay safe this Tuesday.
Good morning, Singapore, and welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Geraldine Tan from the therapy room. Good morning, Jerry.
Good morning, and apparently my cam is a bit too high, so I'm going to shift it up.
That's okay. You look beautiful nonetheless.
You know what's high enough? This is high.
Okay, so we're on air right now, and we're talking about adjustment disorder, Dr. Jerry.
Yes.
And you were talking about the five
The
pillars,
5 pillars,
that
so-
we should pay attention to.
Physical, intellectual, social, and then?
The social, spiritual, and emotional. Yeah, so these 5 that we oftentimes talk about, and we will keep repeating until people get it, okay? But yes, it is very, very difficult to see how we can prevent, because it's just like cough and cold. You try, you can wear a mask, but at the end of the day, if you're going to catch it, you're going to catch it. So disorders are like that. It doesn't discern whether you are rich or poor, old or young.
Or you can get your flu shot. From
No,
Parkway
no,
Medicine
no,
Centre
not the
at
same
Woodley.
thing, not
I
the
just want to
same.
say good morning to everybody at Parkway Medicine Centre at Woodley.
So,
Get your flu shot.
So, Dr. Jerry, like when you say it's very difficult to discern what somebody needs, is it because each of our needs vary depending on what we're going through, and it could also be that the next day that need has varied again, and so on and so forth?
It can be from day to day. It can be from a person to person, like different personalities, different times in our lives. We face different stressors. So it could be a whole series of stressors that have culminated, and we just need one more to kind of tip us over the edge. Yeah. So, for example, that case, and it's not my case, so I really don't know. I'm just, looking at the article and commenting on it. So it could be business stressors. It could be perhaps even trying to management issues. It could be before even financial, right? The joy of having an unborn child, but the stress of having an unborn child.
Yeah.
It could be moving location. It could be so many other things that has come together in that pot, stewing, and all he needed to hear was one more bad thing to tip him over.
As someone who's part of a larger family, how do I recognize if someone is heading this way?
So this disorder, adjustment disorder, so any disorder, you start to see them doing things out of character. So if they are not sleeping well, they are telling you, I'm not sleeping, and it's already more than 1 week, they should get some help. Because how can somebody sustain functioning if they're not sleeping well, right?
Sleeping pills.
You and your substances.
No, but
right?
but Jerry, even if that's someone,
Substances rock.
even if that's someone, I tell you what, when we come back, I've got something to say about the sleeping pills.
Okay, it is 8:13.
Kiss 92 time check brought to you.
Yeah, lah. If you can't sleep, just go get sleeping pills.
No, but you see, Jerry, and I want to comment on that, because if someone suddenly requires sleeping pills, that too is a sign,
Yeah.
or may be a sign.
Yeah, it is. And it doesn't mean that the sleeping pills will work, because if you're in quite a state, right, and you're in a very heightened state, that is, the sleeping pills, they oftentimes will complain, even with the sleeping pills, they sleep only 2-3 hours. Yeah, so, yeah.
What about like something like substance abuse? Like, when I talk about substance, I don't necessarily say hardcore drugs, but like, your sleeping pills, your alcohol, stuff like that, painkillers maybe.
I think
Food.
all
Yes,
that is
so-
okay, but that's where I draw the line. After that, no more.
What?
Cannot.
Well, if you
Painkillers,
do
okay.
sleep,
If I'm in pain, I just take one Acoxia.
Yeah.
That's all. If the pain is not so bad, I just take 2 Panadol extras.
There you
That's
go.
all.
Okay.
Hangover, 2 Panadol extras.
You should get Panadol to sponsor you.
Acoxia will help your inflammation as well, whatever, you know.
It's like Glenn Ong recommends Panadol, takes all your pains away.
Unhappy, 1 shot of mezcal.
There you go.
Yeah, but the thing is, when you start seeing them take more than usual. So if we see Glenn taking Acoxia like every day for a week, then we will bring him to the doctors. If
We'll
the
just carry you to the doctors.
Yeah, if the Panadol is like being popped like 4 times a day for like 3 days in a row, we might want to go, okay, but you're not having fever. What's going on here? So when we see a sudden increase, a rather acute increase, then we probably would want to ask the person if there is anything wrong.
Dr. Jerry, do you see adjustment disorder more in children or adults or teenagers, or I mean, is it equal across the board?
So more commonly diagnosed in children and teens.
Oh,
So if the adults, we usually have more coping mechanisms. So it's not that we don't have. We do diagnose them, but not as common as children and teens.
okay,
Yeah,
got it.
so
Okay.
so probably one of the older ones that we've seen would be during COVID period. And during COVID period, there was one of the more senior gentlemen. You know, he had to deal with his business, and the business there was a lot of uncertainty. There was a lot of changes in the work environment. So that could have been diagnosed as a adjustment disorder. But adjustment disorder also comes with various like categories, subcategories. So there's adjustment disorder with depressed mood, adjustment disorder with anxiety, adjustment disorder with both types, anxiety and depressed mood, adjustment disorder with disturbance of conduct, and then the case that we had in the papers was adjustment disorder with mixed disturbance of emotions and conduct. So he was diagnosed with all the different subcategories added together. So he's had adjustment disorder, that means a big event that had happened.
Work, yeah.
And he had depression, anxiety, and conduct issues.
Yeah, it's a
So
big thing. I mean, just having a baby alone is like a big adjustment. Can you imagine when all that financial stuff comes into play?
Yeah.
It's hard.
I'm just listening to Jerry, and I'm wondering, you see it more in children and in teens. You don't see it in adults.
As
that
much.
doesn't necessarily
Not
mean
so.
it's not prevalent.
Yeah.
It's just that adults
Yes.
tend to hide their emotions so much.
Like FD.
Most of us tend to hide, especially in Asia, right? But adjustment disorder is also quite difficult to diagnose. So oftentimes we might see the depression, the anxiety, so the more emotional parts of it, and then we just treat that depression and that anxiety, and we don't call it adjustment disorder. Yeah, because those symptoms are more obvious and more at that forefront that they complain about. Yeah.
Actually, some people think they are hiding their, they're deceiving everyone, by behaving normally and all that. But everyone actually knows. Like FD, for example. I know most of the time he wants to kill me.
Yes, this is true. You've
But
told me, actually.
I can see it in his
that's why-
eyes.
Yeah. No,
I
but he's
don't-
told me he hasn't told you.
Oh, is it?
But Dr. Jerry, I mean, which brings me to the point, right? For adjustment disorder, can it be
Yeah.
hidden? Can someone who actually suffers from adjustment disorder hide it so much that other people can't see it?
They can hide it for a while, but they cannot hide it for long. Like they try to manage it on their own. They try to deal with it. So by the time they come to us, it would be probably a few weeks or even a few months.
And it comes off quite close to depression?
For some, so it looks like depression, it looks like anxiety, but anyway, it does come together with it, right? Sometimes, so it comorbids with it. They have the depression symptoms, they have the anxiety symptoms. In this case, he had the conduct issues. So sometimes we see people with anger issues. And what do we say? We say, give him a break, lah. He's going through a tough time. Why do we say that? Then that is also, we are alluding to, he has a recent adjustment and he is not coping well, isn't it?
Yeah.
So sometimes it is not that severe. We are a bit more irritable. Perhaps we moved house, for example, and then we are very tired and very stressed with all the moving, and we throw a little bit of a temper, and someone says, "Oh, give him or her a break.
Yeah.
She just moved, or she's going through a rough patch." Yeah, but it doesn't last for a long time. So when we talk about adjustment disorder, the reaction does last for a longer period of time.
Okay. So what kind of treatment is out there?
Which brings me to my next question, actually. So, when I do start seeing you and you become my therapist, Jerry, and when I sit down, right, are you the one who's going to be talking to me, or am I supposed to be like vomiting on you, that kind of thing?
That's a nice question. Yeah. Sometimes it is difficult for the person to articulate, right? So yes, we will ask the question, what has been happening? Can you tell me a little bit more about it? But we will pace. So in sessions, it's not our pace. It's not the therapist's pace, but the client's pacing that we go by.
Because I think I will be one of those people, right? Who the
can't
moment I
stop
sit down,
talking?
I'll be talking, and then 1 hour will be up, and then okay, that's it.
You think so?
Let's go. I think so.
Yeah, no,
and I feel like
you know what? We know so.
and then I won't be getting my money's worth.
Glenn, you are getting your money's worth.
What?
Because you're
by
allowed to
talking,
just-
you're letting that
No, I can do
out.
that with y'all.
That's true.
Seriously.
He can. Have you seen that there are times where we're all walking together and then you're talking to somebody and you just get left behind?
Yeah.
Have you noticed?
No.
And you're kind of like, oh, where's everyone else? We've just gone and we've moved on.
Oh.
Yeah. Happens all the time.
Okay. So we're going back on air. Okay, stand by.
Kiss 92 traffic.
Watch out on the PIE heading towards the airport. Right before the BKE, vehicle has broken down there. Also on Bradle Road, if you're in our area, heading towards Bartley, a vehicle's broken down after Marymount Road. Avoid the left lane if you're headed down that stretch, and drop us a WhatsApp if you spot anything. It's 88550920.
Round. Sorry.
What?
Round?
Round.
What's round?
Kelly Clarkson.
Oh,
You know-
Glenn Ong.
No, because earlier on we were talking about Ed Sheeran's song "Shape of You."
Yes.
So now every time we play a song, I'm thinking "Shape of You."
Okay,
So,
shape of that person.
Kelly Clarkson,
Round.
round.
Okay.
So
Okay, you're allowed. It's a shape. Okay, hi, we're with Dr. Jerry, and we're talking about adjustment disorder this morning.
Yes, we are, and I was talking about all the different subcategories. Whether it's depression, anxiety, mixed conduct, and then the mixed disturbance of emotions and conduct disorder.
Okay.
You know, Jerry, so many people, and this is not just about adjustment disorder, it's about anything that you guys deal with. So many people go to you as clients and you treat them, you counsel them.
Yes.
How do we, as the family, back up that treatment that you give?
Okay, so we were going into treatments earlier. So one of the treatment would be family therapy, because many times it is tough to try and understand, because you're on the peripheral. You say, "Oh, but this situation should be quite easy to deal with. Everybody has done that before. Everybody has gone through that before. You should be able to do it." So we will pick out like how to communicate differently, because sometimes the language grates on the person and they remain in the disorder a little bit longer. Yeah. So a lot of communication work, a lot of bridging work, a lot of helping the family to heal together, because they can also be part of the stressors, or the family could be going through stress together. For example, something happy, right? Like there's a birth of a new sibling. Okay, so mommy is pregnant, and then we keep saying, please prepare your child. Why? You hear of the young child rejecting the baby or the newborn baby. We say, oh, we start labeling too quickly, and we say this child, this older one is jealous, is being naughty, but the child is going through an adjustment. And the family is going through an adjustment. So everybody needs to prep. So we start alerting them that, okay, we all need to prepare of the change of this newborn baby coming into the midst.
Yeah. And what if any parent listening now has a child that they think may be sort of going through adjustment disorder, what can they do?
Well, now is the best time. That's why I also wanted to talk about adjustment disorder now, because you have 1 month to prep for next year's start of school, whether it's P1, P2, P3, secondary school. For those that are going into like JC, a lot of preparation work can be done during this period of time. So it could be as simple as buying books, buying your uniform, getting to know that space, getting to know the academic space.
Spending time with them.
Spending time with them, yes, definitely.
Yeah.
Yeah.
And I was just telling the team this morning, I'm thinking about next year, and I'm feeling a bit like stressed out and anxious. It's true. I did tell you guys that.
Yeah,
today.
you did.
Yeah.
So I think I'm going through
Why
something
are we
like,
stressed?
Adjustment
dear.
disorder.
well, it's just me, I guess. We'll talk about it. I'll tell you on the Big Show TV.
Okay.
How about that?
Ooh.
Everyone who's not watching us on the Big Show TV will never know what I'm about to say.
That's true, never.
Anyway, here's Eliza Rose and Calvin Harris, Body Moving on Kiss 92. Yeah.
Okay, so tell us.
Yeah, lah. So
Oh, no, you
because I was
tell
like,
Dr. Jerry.
oh yeah. So yeah, because I'm thinking like, how do I go and we need to crush the competition. Absolutely crush.
So how do we do it?
Yeah,
we
that's the
can't tell
thing.
everybody. Yeah.
Yeah, of course.
Yeah,
That's
no.
all I can say.
Yeah. Don't tell.
Right.
Yeah. So as a team, of course, we have to, plan this, right?
Yes.
Yeah.
So once the new year starts, that's it.
Yes.
So we're gonna tell you.
It sounds big.
It's always big. Always big. We have a question for you, Dr. Jerry, from Nicholas.
Okay.
He says, "Dear doctor,
Dear doctor.
Dear Aunt Agony.
yeah, sounds like a song, dear doctor. There are many new disorders defined today. Is society becoming softer and being self-fulfilling when they hear about these disorders, or are we just diagnosing better?"
Okay, so all these diagnoses have already been in our DSM-5, our diagnostic manual. Where's my diagnostic manual? Let me just pull. It's very convenient to sit next to my bookshelf. So the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, there is a manual that is always out there that we follow. and it is updated. So this is edition 5. Hopefully they don't come up with 6 too soon. But anyway, it's constantly evolving.
Is there an audiobook for that?
There, I'm not sure. Good question. Maybe
There might
there
be.
is.
Or maybe like some cliff notes, let's summarize everything.
Yeah.
Let me search for it later.
Oh, there are cliff notes. There you go. She's like, yes, we have a piece of paper here that says everything you need to know.
Yeah, so there's a smaller one.
Oh, there you go. Okay.
And you can see I've marked out some of the things.
Is it just smaller
yeah.
in paper, or is it the same amount of words?
No, this one really has very, very tiny words. Look at
okay,
that.
okay.
Yeah. If Jerry is carrying her tote bag, she'll put the big one inside. If she's carrying her little,
She'll put that in the back pocket.
yeah, then she'll use the smaller one. She'll bring the
Yeah.
smaller one.
So the diagnosis, or rather the disorders, are in the book itself, or in the manual itself. It is there, but we've never waved it around or publicized it. Previously, there's no internet, there's nothing, right? But now with people wanting to know more, so the terminology, the disorders are being shared out there so that everyone is not scared. And that's why I wanted to do this, because people were starting to be scared that adjustment disorder has hallucination, has psychosis, has aggression. And I wanted to debunk that myth.
Right.
So are you saying that all the disorders that you've been speaking about are all in the book? Are there new ones that keep getting added, year on year?
No, so they
No.
changed some of the terminology, where they fine-tune some of the categories, some of the disorders. They reterm them, or they combine them, because it's not is maybe not necessary anymore. So for example, Asperger's was a category on its own, but now it's subsumed
Autism.
into autistic spectrum disorder.
Right.
Is part of that whole spectrum. Dyslexia is not on its own. It's now subsumed into language disorder. So that was like 2 editions ago or something like that. Yeah.
Oh, okay. So
Yeah,
everything
yeah.
exists already. Nothing has changed.
Yes. But I really like this question, because if you go on TikTok, there's so many strange disorders out there that sounds logical, but they are not in our manual.
Oh,
Yes.
okay.
So that's one reason why when teens go onto TikTok and they come into session and go, Auntie Jerry, I think I have this disorder. I go like, what disorder is that? I've never heard of it before. Oh, but Auntie Jerry is trending. We're like, okay, I don't know what you are watching.
Having said that, can we talk about disorders that don't exist next week? Because a lot of people who watch us and listen to us either have teenage children or children on TikTok, and we don't want them confused to think that they are suffering from a disorder when it doesn't even exist.
Okay.
I just want to say Asperger's reminds me of a vegetable.
Okay,
That's
that's
asparagus.
asparagus?
Yeah.
Yes, and my favorite Asperger's is white Asperger's.
White Asperger's with butter?
Yeah, I know I'm going to upset people when I say this, but this whole TikTok thing, and you're worried about people diagnosing themselves with conditions and disorders that they don't actually have.
Yes.
I think
yes.
sometimes it's almost a badge.
Of honor to
Yes.
wear?
Yeah.
Yes, exactly. I love it how FD always, cuts through everything and tells us the truth. It is true. The teens will come and say, I've got this disorder, and they feel very proud of it,
Yeah.
But having said that, because I don't know all the weird disorder, I'm not on TikTok, so I don't know
Okay,
the
we'll go
disorders
find out.
that are there.
Yeah. FD,
yeah.
Unlike
that's your-
FD is Mr. TikTok.
FD, that's your homework. Since you're always on TikTok,
My
go look
homework.
for the disorders, okay? Write it down.
No, the algorithm will not read it, so I actually need the help of our viewers out there,
Okay.
to try and put into either YouTube or the Facebook, and let us know what your teen is watching and diagnosing themselves, so
Yeah.
then I can talk about it.
Yeah.
Please, that would be awesome. We have a message from Raymond Francis. Says, good morning, everyone. FD and Glenn. Oh, thank goodness I don't have my own name in here. Did y'all have your own adjustment disorder when you changed stations, and what was it like? Hey, I also changed stations. How come you didn't write my name? Okay, but I think he's talking about from the other side to here.
I was extremely stressed, actually.
I think we both were.
On that first day. But for me, it's always that first day.
Jitters.
Right? Once,
It's
not
jitters.
really jitters. I just get like, my blood pressure probably goes up. I just feel like I just want to get a feel of that first.
Because you don't know what it's going to
show.
be like, whether people are going to like you on that
No,
station.
not so much that.
No?
I just need everything to work smoothly.
Oh, okay.
Yeah, that's it.
Okay.
That's all.
Okay.
But it was just that one show. Second show is okay.
I was very fearful. I didn't know whether or not I would enjoy this because music is younger, everything is younger. And
Oh, you're talking about that
from
here.
there to here.
Oh, right. Okay.
And basically, at the end of it, I found that I ended up feeling better. The music was younger, and I accepted the music for what it was. And suddenly, I just felt better about it. I felt younger. I felt that this was something that I could really do.
Yeah. And I think the Kiss 92 listeners, always wanted a grandpa, on the show. So now we've got a grandpa.
And we have Santa Claus all rolled into one.
Thank you both. Thank you both.
You should be going out there as Santa Claus.
Anytime.
Okay.
Thanks,
Let's go back on air. Stand by.
Why can't we be like that? Wish we could be like that.
Little Mix featuring Jason Derulo, Secret Love Song right here on Kiss 92. All the great songs in one place. It's Glenn, Angel, Santa Claus, and Dr. Geraldine Tan from the therapy room. I'm going to talk to the bosses today. Since we've got a 70-year-old guy on the show, the grandpa of radio here in Singapore, with us on Kiss 92. What the hell is he doing sitting in the studio most of the time? As we approach Christmas,
26 days.
We need to put him in a Santa outfit
And go
just
spread some cheer.
Yeah.
Yeah. You should be out there tangling all with the snow.
No other radio station has a Santa Claus. We have
This is true.
a Santa Claus right here.
This is true.
Just put a Kiss 92 sticker on his forehead. Put a Santa outfit on and just get him to go around and,
Yeah.
promote
FD?
us.
FD?
Yeah.
You could wear a purple Santa outfit. How about that? It says Kiss 92.
Yeah, right?
Very nice.
We're going to push into adjustment disorder.
Yeah, right into it. I'll head right into that adjustment disorder pretty soon.
Okay, we're with Dr. Geraldine Tan from the therapy room, and we're talking about adjustment disorders this morning.
Yeah.
Yes,
So,
we are.
what can parents do if their kids are going through adjustment disorders right now?
I mean, okay, so we were saying it's hard to do preventive work, but for adjustments that are available out there, adjustments that we know and we can preempt, like change of school, change of environment, new sibling coming, change of work, all these we can prepare. Yeah, so even for those that finished O levels and A levels, I prepare them for after the exams because that oftentimes is a crash. So what I will always prepare these teens who have depression or anxiety, I would prepare them what are they going to do during the holidays. And, they would be able to narrate to me after a while what they're going to do, where they're going, who they're spending time with. So that's very useful for them.
Okay.
All right.
Yeah.
Very cool.
Yeah, so during therapy, we do cognitive behavioral therapy. So most of the time, we work with them on different social skills. Sometimes they are lacking in social skills, their own anger issues or stress management. Some of them don't know how to manage their stress. So we work on that.
Okay. We've run out of time, Jerry. Almost time for us to check on out of here.
Oh my God.
I know, because we've got a few things we need to,
Get
put out.
done.
I think
Yeah.
the next one we've got a message from the Singapore Police Force coming
We
up.
do, yes.
Wow. Okay.
So
Okay.
I just want to, in case I forget, I think we should talk about this next week, okay? Because I've been wanting to bring this up. Like now, more and more people. I mean, it's good that everyone's seeing a psychologist or psychiatrist and all that. But the first time round, usually, when people start to feel like, especially the kids, like what we're talking about, right? Some of them, it's like a badge.
Yeah.
You were
Yes.
saying,
A
right?
badge.
Yeah.
They might not necessarily. It might not necessarily be so bad, but they might be exaggerating it a little bit because maybe they want to go and see a psychologist or something like that, and be able to tell their friends, you know what? I've seen a psychologist. I've seen a psychiatrist.
It's a badge of
I
honor.
think they just want to have something to blame it on as well, whatever their behavior
Yeah,
may be.
but nowadays I think parents. I mean, they're not gonna ask their kids to look, suck it up.
Yeah, no, not as
You know
much
what I
as
mean?
before. No,
But that's what I want to talk about next week. Is it acceptable for some parents to go, look,
live with it.
just live with it? Just be tougher. Okay, we'll talk about that next week.
Okay.
one.
Okay, but
Okay.
before we go, your last words,
Yes.
Jerry.
Sure. So Winston Churchill says, success is not final, failure is not fatal. It is the courage to continue that counts.
Yes.
True.
Don't quit.
Never. Keep going.
I won't say never lah. I mean, if you have to
Never.
tap out, you have to tap out.
Yeah,
If not, you go to
that's
sleep.
why you have to tap out. But
Yeah.
yes.
Yeah. Okay, thank you so
I'll
much,
see you
Jerry.
next week. See you.
Thanks,
Bye-bye.
Jerry. Bye bye.
Bye bye. Kisses.
Big kiss. Bye bye.
Wake up.
Glenn, Angel, and the Flying